The Paediatric Association of the Gambia held its second scientific meeting on Friday, November 15, 2024 at the Dawda, Kairaba, Jawara International Conference Center in Bijilo. Theme, State of the Gambia Child and Child Survival Interventions. The event provided a platform for stakeholders to evaluate child health policies and propose measures to improve maternal and pediatric care nationwide. Here is Awa Sanneh with the details.
Healthcare professionals and child advocates gathered to address pressing issues such as neonatal care, maternal mortality, and child health outcomes. The meeting stressed the need for collective efforts in strengthening pediatric services and promoting sustainable interventions. Dr. Mustafa Bite, Chief Medical Director of the Edward Francis Moore Teaching Hospital, highlighted the institution's role in training pediatricians, while urging the association to focus on maternal research to improve neonatal survival rates.
Together we can provide the optimal training. We hope that we can work together in developing protocols. We see that in other associations, developing guidelines and for treatment. The hospital hopes to explore your potential to develop our research culture in the hospital. Currently in our hospital, I think we are managing only 5 grants. With the level of staff we have here, with the capacity of the people that are in the hospital, that is too low. And we think that we'll work together, you support us, so that we can, by next year, maybe we'll be managing 10 grants and continue to improve as we go. So our research culture really need to improve, and I think we can harness the potentials that you have to help us in this.
UNICEF's Dr. Nafisa B. Shafiq called for urgent action to reduce infant and maternal mortality, aligning with national development plans and the United Nations Sustainable Development Goals.
This conference provides a vital platform to examine both the strides we have made in child health and the challenges that require urgent attention. It cannot be business as usual. We need to find a way to make things as such that there will be no infant mortality, maternal mortality in this era when we are talking about AI-driven power. It's just unnecessary for a mother or a child to die today's world. And these are all manageable. We can manage those cases. Together with the government, development partners, civil society organizations, and communities, UNICEF remains.
Professor Gabriel Ogun, administrator at the School of Medicine and Allied Health Science at the University of the Gambia, emphasized the significance of strengthening pediatric education to enhance child health care delivery across the country.
A lot has been done. A lot has been achieved. A lot will still be achieved. It is a matter of time. It's a matter of struggle and resilience. It's a matter of accepting the training and becoming what we are made to become. The postgraduate training started getting a boost when the sponsorship came. But even before then, some people had had their training sponsored outside the country, but it's expensive. And that means only limited people could be produced. But Gambia needed many more people. And just as Gambia attracts a lot of tourists, we believe that Gambia should also be able to care for the tourists and even from people around them. We have noticed that it's rather expensive to assess health in our closest community or our closest country. Why don't we reverse it? And Gambia has started.
Professor Yankuba Kasama, representative of the Director of Postgraduate Training, urged for better regional access to pediatric services and improved data management to monitor progress in child health.
Admonish the Paediatric Association of the Gambia to ensure that they provide a program that expands pediatric care beyond just the West Coast region or the Greater Banjul area to other parts of the country. That is an admonition I will give to you. Then we also look at safeguarding of our population. It's recommended, and we're suggesting that that also should be kept in our mind. Then data and record keeping has to be ramped up, as Professor Salah said, because data is what gives lives. And in anything, and when you plan, data is the...
The conference concluded with a renewed commitment from participants to drive collaborative strategies aimed at reducing child mortality and improving maternal health outcomes in the Gambia. For Star TV News, this is Awa Sanneh.